Awesome. I think I'm going to get started. Hello and welcome to our webinar on Selfbook, our appointment booking solution for you to invite patients to book face-to-face appointments. Just to let you know, this webinar will be recorded and we will email all the recordings out, the recording of the webinar out to all the registrants. Things I'm going to cover today: what Selfbook is and how you can use it. What's new with Selfbook? I'm going to be joined by Sarah Botherway, a practice manager from Padcaster Medical Centre, who's going to share her experiences with Selfbook. And we're going to finish off with a Q&A session where I'll answer the questions that you sent in the chat. Also, just to let you know, some of my Accurates colleagues are in the webinar and they will be typing up some replies to your questions in the chat. So, what is Selfbook? Well, it's one of our newest features to help manage appointment bookings. Selfbook allows you to send a single-use booking link for face-to-face appointments directly to patients via SMS. It uses the existing slot types from your clinical appointment book. You can specify the slots before sending the link so that you're in control of what appointments patients can book into. Selfbook is fully integrated with System 1 and EMIS, so the appointment seen by the patients will be a reflection of what's in your appointment book. And once they've made a booking, they'll be automatically added into that clinic slot. Selfbook can be used for sending booking links individually. It can also be used for inviting groups of patients via batch messaging. And this feature is available to all practices. So far, you've sent a whopping nearly 17 million batch Selfbook invites and over 700,000 individual Selfbook invites. And we have a nice quote here from practice manager in Wilmslow. Accurates batch Selfbook is the most amazing thing ever. It's been amazing for our flu clinics, saved us many hours of work, plus paper, ink and postage. It's easy to use. I can't say anything negative about it. I love it. So that's really nice to hear. And here's what we've used it for. So vaccination programs, smear tests, acute bookings, long-term condition reviews, and other recall purposes. And again, we have a few more quotes here from some other user experiences. An IT support manager from Somerset said, all you need to do is configure your slot types. It's really easy, saving time and stress all round. An operations manager from Lewisham said, easiest flu season ever. And another operations manager from Trafford said, we're going to use it for all our chronic condition reviews. That's great. What are some of the benefits? So Selfbook saves you hours booking patients in and frees up your phone lines. Instead of inviting patients to call the practice to book an appointment, patients can book directly via the link in their text message. This means less phone calls for booking appointments and freeing up the phone lines for those urgent calls. It streamlines processes and integrates seamlessly with EMIS and System 1. Another benefit, as mentioned, is that Selfbook works off your own appointment book. It's fully integrated with System 1 and EMIS, so that patients are booking themselves directly into the appointment book without any intervention required from practice staff. And Selfbook provides easier access to care and improves the booking experience for patients. Patients have fed back that it's easy and simple to book an appointment. They have flexibility and autonomy when booking their appointments, which should reduce DNAs. But pretty importantly, how can you use it? So I'm going to demo 3 ways you can use Selfbook. First of all, I'm going to send a batch Selfbook invite to a list of test patients. And then I'm going to send an individual Selfbook link and show you how to do that individually. And then I'm going to show you how to use Selfbook to respond to patient inbound. So I'm just going to share my screen. Perfect. So this might be a screen a lot of you recognize. So start off with how to send batch Selfbook messages. So the first thing I'm going to do is click on my initials, and then I'm going to go to manage organization. That down here. Perfect. So this is your manage organization page. The module we're sort of looking at is this messaging module at the top here. And we're going to click new batch message. Now, depending on whether you procured batch messaging from us or not, you might see a few different things here, but everyone should see this option here for Selfbook. So this first page is where we're going to compose that message that we're going to send out to these patients with that booking link. So at the top here, we've got the option to choose a slot type. So I'm going to click on this drop down here, and I'm going to choose a slot type that I want these patients to be able to book into. It shows the number of appointments available to help with capacity management. So I'm going to click on Smith, this example. If your slot type isn't showing up that you're expecting to, or the appointment number isn't also sort of as expected, this might be because we're currently refreshing your appointment book, and it may take up to half an hour for us to be fully refreshed there. So it might just need a little bit of waiting on that one. You've got the option to add a template. So these are sort of some pre-made Acrorex templates that we've created to help you with some of these invites. And we've also allowed you to create your own templates. So if you can go back into the manage organization page, you can create your own templates through there and select those as you want. So I'm going to use this cervical screening invitation. Like a lot of our other products, you can amend this message here. You can sort of add things in or take things away as you will. We've limited this message to 307 characters or 2 fragments to help reduce costs for your practice or ICB. You've now also got the option to sort of not save or save this message to the medical record for the patient. As a SNOMED code is attached, that will always save. But if I untick this box here, this would remove the body of the message from saving to the medical record to sort of help with if you're sending lots of messages out to these patients to help clutter there. So I'm going to keep that on for this scenario. And then we've also got the option to allow these patients to decline their invitation. So if I click on allow decline, I can see that I've got a message here that will be appearing for them just before they confirm that they want to decline. So you can amend this to say what you'd like there. And then you've also got the option to add this decline code. So this will be the code that saves the medical record for that patient to say they decline that invitation. So I'm going to choose decline SNOMED code. And so everything looks how I want there. And I'm going to go then to the next stage. So at this point, we need to add a patient list. We have to do this via a CSV file. If you're not familiar with how to create CSV files, we've got some instructions here in sort of just below in how to do this in EMIS and how to do this in System 1. So I'm going to click Upload CSV file. I'm going to select my patient lists. And then at this point, we're gathering that information from medical record and putting those mobile numbers. So I can see this is my list of 8 patients that I've uploaded. I can see that 6 of them have got mobile numbers and can be sent a message. It looks like 2 of them can't be sent a message, and the reason is just shown below there, that they didn't have any mobile numbers in their medical record. Let's continue. Awesome. So at this point, I can review the message. So just double check that everything looks how I want it to. I can see that that sort of the batch type is a Selfbook. We can send it. We're sending it to 6 patients. I can check the message body there, the SNOMED code that I've attached for that invitation. If I've chosen to save this body of the message to the medical record, decline has been allowed, and this is the message that will be shown to them if they want to decline their message, decline the invite. And then we've got this decline SNOMED code as well. Another thing to note, if you want all these things to save to the medical record, you need to have your toolbar up and connect to your EMIS System 1 when sending this message for those to go back. If it's not connected at the exact time, we will try again later in the day. But if it sort of failed a couple of times, then sadly those won't be saved. So it's a good point to make that your toolbar is up and running when sending this. So I'm going to press send message there, and that should send through. And so then you'll be taken to this this batch message table here. So from here you can see all the messages you've sent from your organization. I'm going to click on one I sent earlier, which should show some details of that batch message. So I sent a similar list earlier that had 8 patients that could be sent a message. 7 of those that look like they've been delivered, and 1 looks like it's failed to deliver. And also we can see that 1 of them is booked already. So this booking number will show how many patients have booked out of that list of batch invites you've sent out. Along with that, we've got some more information about that batch message that we've sent, and so you can see that below. So that's sort of everything I wanted to show you in the sort of batch flow. Next, I'm going to show you what it looks like in a sort of individual basis. So first things first, I'm going to search for a patient. I'm going to use Mickey Mouse. And then I'm going to hit the message icon. And we've got, that compose screen. Some of us might be used to sending messages out to patients with. And usual stuff here. You can add a template if you'd like to. Again, this is one you have either created yourself or one that we've created. And then you can add a Selfbook link. So this is the little icon on the bottom left down here. It's a little icon of a calendar, and that is where you can add this Selfbook link. So I'm going to add a template for smear invitation again, keep it consistent, and then I'm going to add a Selfbook link. We've got the option here to add a booking link for a telephone appointment or for a face-to-face appointment. And so I'm going to click on face-to-face. And then I get to choose my slot type. So this is very similar to the other flow. So I'll be able to select slot types that are available in the appointment book. So I'm going to click on smear, add that link there. And then once I'm happy with how that looks, I can press send now. And that should send that booking link to the patient, as it has done there. And then one more flow I want to show you was how you can respond to sort of some patient inbound with a booking link to invite them to sort of book in for an appointment. So if I go to my inbox here, I've assigned one of the patient triage requests through to my inbox just now. If you're not familiar with Patient Triage, this is our online consultation product that allows your patients to fill out a form and answer these sort of questions. And those sort of patient requests will come through into your Acrix inbox, like so. And so I've assigned this to myself. In this example, if I'm a sort of clinician or someone working at the practice, I could read this request. I can see that they've got a sore knee and they'd like to book an appointment. In this scenario, I can reply to the patient. And the Selfbook option is on the bottom right in this scenario. So if I add Selfbook, we're prompted with the same add Selfbook prompt that we had previously. So I'm going to select face-to-face. And then I can choose from the slot types again. So I'm going to add a routine of slot type this time for a routine appointment and click add. And so that also fills with, we'd like you to book an appointment. Again, if you wanted to add anything else here, add any more information, or say anything else to the patient, you can amend that text message there. And then I'm going to press send and save. Perfect. I'm then going to show you what that looks like from a patient's perspective. So they've been sent this text message. And so I'm going to click on this link and fill it out from a patient's perspective. So click on that. Track this down. And this is what they would see, the patient, if I clicked on that link. As usual, I'm going to need to fill out the date of birth, scenarios. Confirm. Brilliant. So logged in through that security step, and now I'm going to be able to see all the available appointments within the appointment book for that slot type. So I'm going to go through here and I'm going to look at Thursday, 9th of March, and I'm going to select 8:50. We show like a randomized number of appointments in this step. To try and avoid 2 patients booking the same appointment at the same time, but not to worry, they can't be double booked. So if so basically the first patient that confirms the appointment will get that slot, and then the other patient that maybe have clicked it at the same time will be with a sort of sent a message to say that appointment was actually didn't go through successfully, so they'll be redirected back through the flow to book another appointment. So if we wanted to show all times, we can do that just by clicking that button too. But I'm happy with 8:50, and I'm going to press continue. And now I can review that appointment and then press confirm. And so at this point, our system is just double checking within the medical record system that the appointment's still available, and hopefully booking myself in. So yeah, we got that appointment has been booked. At this point, the patient will receive a confirmation text to let them know that that appointment's booked in. This is the time and date that it is. It's a in-person appointment, and it will give them the location of that appointment as well. So there. Brilliant. And so and then they'll be booked straight into the appointment slot for that day. That's the sort of the demo that I wanted to show you today. I'm going to stop sharing my screen and go back to the slides. Brilliant. So what's new with Selfbook? Thanks again for all your feedback. Based off that feedback, we've made the following changes. It's now possible for patients to book up to 6 weeks in advance. Patients can book appointments for the same day, so this should help with those acute bookings that are made last minute. There's now the option for patients to decline the appointment, as I showed you in the demo, which will leave a decline code in their medical record. And things we're working on next, extending the 48-hour link expiry to 7 days, and the ability to choose a clinician. Awesome. So I'm now going to pass over to Sarah, by the way, a practice manager at Tadcaster Medical Centre. Sarah's been using Selfbook since September 2022, and she's going to talk us through some of her experiences. Sarah, are you there?
I am.
Fantastic. Hi, and thanks again so much for joining.
That's okay.
I wonder if you could get us started by telling us what you've used this feature for so far.
It's become a really key part of our working practices. We started using it obviously as early adopters in September last year for the flu campaign. It was a really smooth process. It was great to be able to see how many people were booking, very quick and easy compared to using other solutions. And what was great was we could mix different sorts of appointments within the same session, which our previous System 1 option didn't allow us to do. Since then, we've started using it a lot with our online triage. Doctors or the clinicians can send links for what they think is an appropriate appointment from that consultation rather than needing to involve any other bits of the building. We're sending links out for chronic diseases and for blood tests. And we're also using it for things like smear tests with the working age population, because it stops that to and fro conversation on reception that can take an awfully long time when you're trying to work around someone's work patterns. I think we all had a long period of time where everyone was available whenever, but now the world's gone back to normal. You know, people have other things they want to do and need to do, and giving them the ability to make that decision in their own time with their diary or their rota for work saves a lot of reception time.
Very good, thank you. You mentioned you used to use the sort of System 1 booking system. Are there any sort of, you mentioned a few benefits of using Accurate or sort of differences from that system?
We like it for appointment booking because obviously you can only see the appointments you've been sent a link to book for. With System Online booking, we always had to audit whether patients had booked into the right slots, even though we only had smear slots for a long time. You'd still get people booking in who were male or who too old with just a comment to say it's not a smear, it's something else completely clinically inappropriate. And it also, with the flu campaign and with all the rotas now, you can just have a mixed rota, which has got some slots our receptionists are booking in, some slots that are visible to the Accurix link patients, but it doesn't have to be a specific rota type. With System 1 invitations, you could only send one sort of slot type for that rota, so we had to break up our traditional rota patterns to slot them in for flus and things when we just wanted to do a few at the end of a day, so that it just makes everything much more flexible.
Thank you. That sounds great. And how much time would you say this has saved you with sending out appointments sort of in this way?
It saved a lot of time on reception. The flu campaign obviously is a once a year thing. It has saved us a lot of time for that, but a lot of that had gone to system 1 automation. Where it saved time is the receptionists getting those messages from the doctor, please can you book this patient for this, please can you book this patient for that, because in a lot of cases the clinician's already done that itself. I think the problem for us and for any practice of this last winter is that you don't feel like there's any time saving, because all that happens in this time that was saved is you take another phone call or you deal with another query, because demand is just so mad. So what I would say is it's allowed us to retain our sanity probably for longer than we would have done had we not had it.
Oh no, that's really good to hear. Thank you. Yeah, thanks so much again for your time, and it's really great to see that Selfbook has had a positive impact to your practice. If anyone has any questions for Sarah, they could type them up in the Q&A, and I'll have a look in a minute. We can see if we can answer any of those.
Okay.
But no, thanks again so much, Sarah.
No problem.
Very kind of you to join. Brilliant. So next we've got the Q&A. So I'm just going to have a little look at some questions now and see if I can touch on some of those points for you. So a couple of people asking about what the ratio of invites to available, what is the ratio to invites to available slots? So we show a warning message if you're inviting more than double the available slots that are out there. So there's no technical block in place, but there is definitely a warning message to let you know, you're sending out sort of 100 invites if there's 50 or less available slots, just to let you know that there might be a sort of a situation where patients will see that there's no appointments available, and then that might not be covered. So that's sort of, so we set that warning in place for that. And we know sort of response rates are sort of very different for slot types. So we definitely want to set a limit for you on that one. We've got another question here. Is there any way of seeing a list of patients who have declined an invite, or is this in the works? So that in the batch flow that I mentioned earlier, you can see the number of patients that are booked in, and so sadly it's not clickable for a list of all those patients, but it'll show you a rough idea of how many patients are booking in. But you'll be basically attaching a SNOMED code for that decline. You'd be able to pull this from your medical record system to see that list of patients that have declined. Another one here: can the patient cancel an appointment, or would they need to phone in? The patients can't currently cancel their appointment through that booking flow, and this is something we're looking into. If you have appointment reminder set up, they'll be able to cancel their appointment through the appointment reminder. That can either be sent a week before or a day before, and so there is a sort of cancellation flow through that. But currently, through that booking invite, there isn't a cancellation option. Sarah, we've got to have a question for you here, if you're still there, that's okay.
Yeah, I am.
How easy was it to implement Selfbook at your practice, and were you able to use it straight away?
Yes, it was. It's as with everything that we've taken up from Acrix, it's really intuitive. The only problem we've had is with clinicians sending the wrong sort of slot on the Selfbook link. So we actually have prefaced every slot that we want using with the word Selfbook in an attempt for them to do that, to use the appropriate one where there was any confusion. initially the clinicians were sending tasks to say, please send a Selfbook link, but now they just send their own for the vast majority. It's very straightforward. And we do use those appointment reminders on all the Selfbook slots so that patients get that chance to cancel if they need to. So it works really well.
Brilliant, thank you. Yeah, that's great to hear. This is for us, I think. Is there a development in place to allow the patient to choose a clinician when booking an appointment? Yes, on one of my previous slides, we mentioned that we are currently researching this, and hopefully get this built as soon as possible. And so yes, that's definitely on our roadmap and something that we're looking to do. Are there any measures in place to prevent patients booking into inappropriate appointment slots? So yes, patients will only be able to book into the appointment slot that the practice has chosen to show them. So you would choose that specific appointment type before sending the link. For example, a COVID-19 booster appointment or a smear test appointment slot, and so they'll only be able to sort of book into that. There isn't anything in place to block patients booking in to a different slot, because that'll be the slot they've been sent out booking in for. And someone's asked, is Selfbook available to you right now? Yeah, this is available to all practices. So yeah, it's available within the toolbar. As I mentioned, it's sort of in an individual basis, and it's also available in batch to everyone. So yeah, there's you can get using it straight away. Someone else has also asked if this webinar is recorded, and yes, this is this has been recorded, and all registrants will be sent an email with that recording. Brilliant. I think one more thing I wanted to mention. Yes, so if you want any more information on Selfbook or batch Selfbook, please see our page here with some interactive demos and more information. Just a reminder that the webinar will be recorded and sent to registrants along with some FAQs for any of the other sort of questions that are being sent in. We'll answer those and write some nice FAQs for you to have a read later on. Thanks all for joining, and I wish you all a lovely rest of your day.